I'm wondering, are parents really trying to do that here in Wisconsin, and why is it dangerous?
We do hear occasional stories of parents trying to get their children who are not yet eligible vaccinated. And I understand why they'd want to do that. There's a lot of pediatric cases. They want to protect their children, but it does look like that dose is going to be different for those younger kids. So it's best to wait for this process to play out. We want to make sure it's safe and effective and wait to vaccinate those younger kids when an emergency use authorization is approved for that vaccine.
And when that is eventually approved, do you think that down the line the vaccine will end up being a required vaccine as others are for students?
I think you're likely to see the COVID-19 vaccine become a required vaccine for other students. Maybe not under emergency use authorization, but like we saw with the adult virus, once it receives full FDA approval, I do think it's likely to head that way.
And something we've heard from parents as kids are going back to school is that they're not surprised by these numbers going up. It was just bound to happen. What are you seeing, though, in terms of the numbers here in Wisconsin, and how concerned should parents be?
We are seeing an increase in pediatric cases, both in cases in general, those kids who are doing relatively well with the disease, but also in hospitalizations of pediatric cases. Here at UW Health, we've never had a lot of pediatric cases, but we are seeing about double the cases as we did the first time around with COVID-19 without Delta present. So it bears paying attention to and doing those things to protect our kids so they don't have to have a battle with COVID-19, whether it's masking, distancing, hand washing. We should be paying attention to those things right now in our kids.
And I wanted to ask you something that's making big news today. So Nicki Minaj tweeted about vaccine hesitancy, and I'm wondering what you think celebrities using their voices like this, what impact does that have on vaccination rates?
It worries me a little bit. I think a lot of these celebrities are just trying to generate some stir around their posts, but unfortunately, there are a lot of people who actually take to heart those things that are posted. And when we post things that just on their face just aren't true, we create a possibility where folks become misinformed and actually think that there's an association with the vaccine and something outlandish that just can't be connected. We really need to trust the experts, look at those large studies with tens of thousands of people in them, to understand what are those side effects of the vaccines, not just an anecdotal story from a celebrity that likely has no correlation to the actual vaccine.
Well, and one thing I thought was interesting, too, is that she tweeted that she's waiting to do her own research. And we hear that from people who say they're waiting to do their own research. As a medical professional, what do you say to that?
I think that's dangerous. I don't mean to be disparaging, but there are individuals who spend a better part of a decade learning how to do research, interpret research, and then summarize that research for the public. So just like I wouldn't do my own research on how to wire my house, I would encourage people not to do their own research per se on medical studies. Instead, listen to experts who do this for a living. They're more likely to come to a correct conclusion than you are by looking on Facebook or other medical journals.
All right, you're one of those experts, Dr. Potoff. We appreciate your time. Thank you.